This video is for education and entertainment purposes only. Please consult with your healthcare provider before making any changes to your health plan. Hey beautiful soul, it's Jacqueline here from the Lost Labia Chronicles in partnership with Lichen Sclerosus Support Network. If you have lichen sclerosus and are looking to empower yourself with information, find acceptance, and reclaim your life, then please subscribe to this channel and keep on watching. And if you have a friend or family member, loved one with lichen sclerosus, and you want to learn more about the mental and physical health aspects of living with LS so that you can better support them in their journey, then please also subscribe to this channel and please share this channel with them. All right, so in today's video, we are going to be talking about a topic that is super near and dear to my heart. We are going to be talking about health anxiety and lichen sclerosus. And we're going to really dive into something called the fire alarm analogy, which is something that really transformed my journey with lichen sclerosus and health anxiety, and something that really helped me manage and kind of overcome my health anxiety. So I really want to just chat about that and share that with you today, because when I opened up about my journey with health anxiety on my blog last year in 2021, I got a lot of people reaching out to me saying, I have health anxiety too, I don't know what to do, and all of these things. So I know that there are a lot of folks out here that have lichen sclerosus and maybe other autoimmune or other conditions, and they're struggling with health anxiety. So it was really important for me to do a video on this topic and to kind of share what really helped me. And of course, there are multiple things that helped me. So if you want all of those fine details, you can check out, I will leave 2 links in the description box below of blog posts that I did on this topic, where I kind of take a deep dive into what health anxiety is and what that can look like for LS, and then all of the different kind of things that are out there that you can potentially tap into to help manage your health anxiety. So for today's video, I'm going to kind of just give a really quick overview of what health anxiety is, what that might look like for you if you have LS, and the fire alarm analogy. What is that analogy? What was my experience, and how did that analogy help me manage and calm my health anxiety? So as always, if you find the information in this video helpful, please give this video a thumbs up. And if you want and you feel comfortable, please share in the comments your experience with health anxiety. Do you have health anxiety? Are you not sure? Maybe you're like, oh, no one ever said I had this, but this sounds a lot like me, this really resonates. Or, if you do have health anxiety, what do you do to manage it? What have you tried? What worked? What didn't? Share anything about your journey in the comments below. I love hearing from you and I love connecting with you. So with that said, we are going to jump into the video. All right, so what exactly is health anxiety? So you might have heard this called by another term. You might have heard it referred to as hypochondriasis or illness anxiety. Sometimes this is just like a country variation, but they're all kind of referring to something similar. So when I talk about health anxiety, I'm talking about worries and fears about being ill or becoming ill. Now, it's really important to note that health anxiety isn't about having occasional worries about your health. It's something that is more persistent and more chronic. So it's normal every now and then. We all, have moments where we're a little concerned about my health. Like, oh no, my knees are creaking. Could this be arthritis? No, I'm probably fine, right? And then you just go on with your life. Or I have strep throat, but I don't seem to be responding to the antibiotics. This is weird. Let me call my doctor. We're not talking about periodic and kind of really spread out instances of these worries. We're talking about this happens every single day, and it can feel really heavy and really all-consuming. So there are perceptual, cognitive, and behavioral components to having health anxiety. So let's go through each of those. And we'll start with perceptual. So perceptual is what you feel in your body physically. So for folks with health anxiety, they almost become hyper aware of all the bodily sensations that they have. Now, our bodies are constantly in flux. Things are constantly changing. Even as I'm talking right now, there are like 50 bajillion things going on in my body, and different sensations. And these are mostly all normal, right? It's just my body doing its thing to keep me alive and healthy. So for most folks, they won't kind of pay attention to these small changes in their bodies. But for folks with health anxiety, they are sometimes hypersensitive, and what might seem like a subtle normal change to one person that wouldn't cause them to bat an eyelash, for someone with health anxiety, that is like a huge, like a red flag just pops up, right? Like, so for example, I might feel a small change in temperature. So I might be sitting here talking to a friend, and then all of a sudden I'm like, oh my gosh, I feel like I'm getting hot. What is this? My body feels hot. Oh no, my head feels hot. My face feels hot. I think my body temperature is changing. And you're just laser focused on that change. And that change feels very, very strong. So there's an urgency that kind of comes along with these bodily sensations. Whereas most people, might not even notice a slight temperature change. And if they do, it's kind of no big deal, right? They don't even think anything of it. They just keep talking with their friend. And that's kind of it. So building on this perceptual component, we have the cognitive component, which is up here, the mind, right? So we have these perceptual feelings, these bodily sensations that we can feel. Now, these sensations are often accompanied by thoughts, which for somebody with health anxiety, those are often catastrophizing thoughts. So let's keep this example of the heat change going, because it's just a really easy one and something that almost everyone that's watching can identify with, because they've probably experienced a change in their temperature, their bodily temperature at some point. So we have a sudden change. You're talking with your friend. All of a sudden, the temperature gets a little bit warmer. And now most people might just think, oh, that's fine. Like whatever, I guess they put the heating on and they just keep talking. Now for someone with health anxiety, that increase in body temperature is associated with thought. And that thought can be a catastrophizing thought, such as, oh no, what if I have a fever? Wait, fever is often a sign of infection. Do I have an infection? Is this dangerous? Has the infection spread to my head? Am I going to die today? Do I need to go to the ER? And it's spiraling, right? Sometimes folks with health anxiety, if they experience that temperature change, they might think there's an infection, and a deadly infection at that. Some people might think it's sepsis or something like that. So it's a very catastrophic thought that's attached to that sensation. It's never a neutral thought like, oh, body's a bit warmer. Okay, that would be a neutral thought. But something is very, very wrong. This is a huge red flag. I've got like blinking lights going off in my head, signaling an emergency. That's a catastrophizing thought. And this is something that is very common for folks with health anxiety to experience in relation to whatever kind of bodily sensation they're perceiving in that moment. Okay, so we have the perceptual component, right? A feeling in the body. That perceptual sensation is accompanied by a cognitive thought, often a negative one, where we catastrophize. I always have such a hard time saying that word, catastrophize. I don't know why, but anyways, we catastrophize, and then that leads to the behavioral component, which is where we take action based on those feelings and the thoughts associated with those feelings. So, for example, continuing on with this heat analogy, sitting with a friend, temperature increases. We notice the physical sensation. With that physical sensation, we get a catastrophizing thought, which is, I might have a fever. This could be a sign of infection. My body is in serious compromised position. I might need to go to the ER. That leads us to act, to behaviorally change. So I might check out of the conversation with my friend. I might excuse myself early. I might then get home and immediately go on like a 6-hour Google search. Like, really, it's all consuming, right? And then in that Google search, I've now diagnosed myself with so many fatal conditions, so much so that I am petrified. I might be having panic attacks. I might have already booked like several visits with different providers, and then I still might get on a bus and go commute to the local urgent care or emergency department because I am genuinely convinced that something is fatally wrong. So there's a strong sense of urgency associated with health anxiety, and that urgency for a lot of us kind of makes us feel like we just have to do, like we just have to run, right? We have to get stuff done. And that getting stuff done looks like booking multiple doctor's appointments, looks like going to the ER, looks like doing, extensive research about these things. And it can be very, very, very distressing and incredibly debilitating. Okay, couple quick things before we jump on and look at health anxiety from a more lichen sclerosus specific lens. The first thing that I want to note is that health anxiety is not a one-size-fits-all condition. So if you're watching this and you're thinking, well, my doctor or somebody, diagnosed me or said I had health anxiety, but mine doesn't seem that intense. That's okay. Health anxiety is a spectrum, and we're all going to be at different points, right? You might have a milder version than somebody that has a more severe, experience with health anxiety, but that does not invalidate your experience with health anxiety. The other thing that I do want to mention is that folks with chronic illness and chronic pain are more likely to develop health anxiety than someone that doesn't have health anxiety. Now, of course, lichen sclerosus is a chronic condition, so just having lichen sclerosus at all could kind of bring that out, bring out some health anxiety. It could lead to that. So you might be more likely to experience that if you have lichen sclerosus. And then if you add more conditions on top of LS, which many of us have more than one thing, then it can make us even more, likely to develop health anxiety at some point. And health anxiety, I'll share my experience in a bit, but it is so debilitating and so distressing. And so it really is important to know what it is and to know what you can kind of do and to seek help for it, because again, it has a huge impact on your quality of life. So lichen sclerosus can bring on or amplify pre-existing health anxiety. So in the context of lichen sclerosus, here are some things that indicate that you might be struggling with health anxiety. Now, this list is by no means comprehensive. It's just to kind of give you an idea. So you may have health anxiety if you obsessively check your vulva. I'm definitely going to talk about that point in a little bit. You might have health anxiety if you think that your LS is fatal, or if you are constantly worrying that you have vulvar cancer. Even if doctors have performed biopsies on the lesions and said they're not cancerous, you might not believe them. You might think they got your biopsies mixed up. That can be, an example of health anxiety. Obsessively worrying about the side effects of your medication can be another thing. Catastrophic thinking about what this condition means for your ability to live a long, happy, healthy life, can significantly restricting your diet for fears that everything that you put in your mouth is going to cause your LS to get worse, which definitely leads to disordered eating patterns in many people, which is why I am very specific and mindful about how I speak about food and LS. Because I'm well aware that, for folks with a history of disordered eating, this can be incredibly triggering and problematic. So, if you fall into any of those kind of categories, then you might be struggling with health anxiety, especially if this is a chronic thing for you and you find it's getting worse and it's really impacting your quality of life, your ability to laugh and be present with your family and all of this. If you're, you should be at work, but instead you're Googling, to see if you're dying for the 20th time that day, then you may have health anxiety. All right, so the information that I've shared so far is kind of, very clinical and all of that. And so I want to kind of break from that clinical talk and just keep it super real with you and, share how health anxiety was for me and how LS made my health anxiety worse. So I have struggled with anxiety ever since I was a little girl. Like my earliest memories that I can recollect were me having catastrophic thoughts about my parents dying, about me suddenly dying. I was just constantly plagued and riddled with anxiety. I've been just diagnosed with generalized anxiety disorder, panic attack disorder, PTSD, and health anxiety. So I am no stranger to anxiety. Had it my whole life, been getting help for it on and off my whole life. And I have to say that things got a lot worse for me when I was diagnosed with lichen sclerosus. So prior to getting diagnosed with lichen sclerosus, I actually had received a couple of other chronic illness diagnoses. So I had trigeminal neuralgia, I had degenerative disc disease, and then I got lichen sclerosus, all in my, from 29 to 31. So for me, the trigeminal neuralgia, the back issues, those are really hard. And I definitely had a lot of health anxiety surrounding those. But the LS, man, was that one special. That one broke me. When I got that diagnosis, it wreaked absolute havoc on my mental health, and it amplified my pre-existing health anxiety and turned it into this epic, all-consuming monster. Like, it was completely debilitating for me. So I'll talk a little bit about, how that kind of manifested for me behaviorally. I checked my vulva obsessively for months on end. And when I say obsessively, I mean I was looking at my vulva or checking over 40 times a day. I probably hit like 100 times some days. Like, I would literally stop what I was doing, check my vulva, go back to my work desk. 2 minutes later, I would be back in the bedroom checking my vulva. It was all consuming. It was this obsession that I don't even know how to describe in words. It's like it had a power over me. It was like I was a puppet, I had no control. I would literally be like, no, I don't want to check. And it would just my body was just doing it. It was so profound, and it really impacted my quality of life, because it was like I couldn't focus on anything else. I couldn't focus on my relationship with my husband. I couldn't focus on my relationship with my friends, with my coworkers. I couldn't focus on work. Everything, every minute, every waking minute of the day for me was fixating on my lichen sclerosus. I was convinced that I had the most severe case possible. And very quickly, I was also convinced that I had vulvar cancer, because when I was diagnosed by my family doctor. If you haven't seen my diagnosis story, I will leave a card up here, and I will also leave a link to that in the description box below. But when my doctor diagnosed me, she said, okay, it's autoimmune, here's your steroids, apply this daily, and then you'll see a gynecologist. Okay, cool. But the wait for my gynecologist was 9 months. So from that time that I was diagnosed, I needed to wait 9 months to get answers. It's a really long time for somebody with anxiety. I mean, heck, a day is really long for somebody with anxiety. So 9 months was very, very difficult. Now, if you've read my blog post on lichen sclerosus in progress, then you know that it took me some time to respond to clobetasol. I didn't get better right away. It wasn't like I put the clobetasol on and my itch and pain was gone. It took months for things to really start to settle and then move into a positive direction for me. It wasn't an immediate thing. But because of that, I would start to think, I'm not responding to treatment. Therefore, I must have vulvar cancer because it's getting worse. And then I would tell myself 9 months will probably be too late for you. By the time you get there and they tell you that you have cancer, it'll be too late. So, I was constantly having thoughts like this, constantly thought that I was dying, that I didn't have enough time. And to kind of really hammer down how afraid I truly was, I filmed goodbye messages to all of my close friends and family. That's how real that thought was to me. That I had cancer, that I was dying, that my LS was going to be the death of me and all of that, because in part, definitely I didn't have the information and education that I developed later. But at the end of the day, health anxiety is really, really powerful, and it's always looking for loopholes and what ifs, and it's always looking to drag you back down into that pit of panic and chaos. And so, that was really hard for me. And I remember sitting at the table with my husband and trying to listen to how his day was, and I just couldn't hear him because my head was screaming so much louder. Go check your vulva. Maybe it got worse. Maybe there's a new lesion that, and stuff like that. And I just then, when I would look at him, I would think, oh my gosh, I can't believe I only have like 9 months left with him or something like this, because that's the extent to which my brain would catastrophize the feelings of itch and the feelings of pain and the thoughts associated with it. They led me to things like obsessively checking and Google searching for days and weeks on end, and, making excessive appointments and doing all of these things that just severely, severely, severely impacted my quality of life. And it was really, really hard for a very long time. So I will say now that I am in a very good place with my health anxiety. It definitely can still creep up on me sometimes. It's not like you cure it or anything like that. It's just that it's way better managed now. And I will say that, learning how to manage that was definitely a journey. One that is not completely over, and that is okay, but I'm very happy with where I'm at now. But it took a lot of work and it took a lot of time to get to this kind of place where I'm much better with my health anxiety. So some of the things that I did to get there, I did go back on my anxiety medication. So I do take anti-anxiety meds. And if you do too, there is no shame in taking medication for your mental health. That is completely and 100% okay. So I definitely did go back on medication, which again, because I've had anxiety since I was little, I've kind of always been on and off, but I kind of recognized in myself that this was getting very, very big and out of control, and that I needed some extra help. Like this wasn't something I was just going to meditate away. I needed something more in that moment. That was a decision that I made for me and my body. That's a decision for you to make about you and your body, of course. Another thing I did was I definitely got a lot of therapy. I worked with a sex therapist who, really covered the health anxiety, but from an LS perspective. But then I called up my family doctor and I said, I'm struggling and I need support. I need to talk to specialists that work with chronic pain patients, that work with chronic illness patients, like a pain specialist. Like, I don't know what you have for me, but I need something because this is not working for me. And so she referred me to a hospital, and I ended up getting admitted into a pain education program at Sinai Hospital here in Toronto, Canada, which is where I live. And I did that program for like a year and 6 months. It was a very intensive program. First, you go through a whole pain education kind of syllabus, and that in and of itself was really, really helpful. And this is going to kind of lead to where we're going to do the rest of the video. But one of the things that I learned in that program, or in the pain program, was something called the fire alarm analogy. And that fire alarm analogy is something that immediately resonated with me, and I would say was incredibly pivotal in getting me from a place of despair to a place of stability. So that analogy alone did so much work for me. I'm telling you, it was absolutely transformative. And so for that reason, I just want to chat a little about the fire alarm analogy, tell you what it is, and why it was so impactful for me, in the hopes that maybe this can help you with your health anxiety. And of course, again, this analogy alone is probably not, enough or the full picture. There is medications, there are therapies, there are so many resources and different things that you can do and experiment with. And again, I will leave in the description box below a link to that blog post where I talk about how to manage it. But for the rest of this video, I really just want to talk about the fire alarm analogy. Okay, so let's discuss the fire alarm analogy. This is the analogy that I learned during part of that pain education program that I was talking about. So pain alerts us to danger, and it helps us take action so that we can prevent or reduce harm to our bodies. For example, I'm sure we've all done this at some point in our life. If you touch a hot stove, we immediately feel pain in the hand, and that pain triggers us to quickly remove our hand from the stove to avoid further damage and a severe burn. So obviously, this is like a built-in mechanism that can be really effective and is incredibly important to keep us safe and out of danger, because that's what the body does, right? It wants to keep us safe. It wants to preserve, our life. Now, similarly, fire alarms work in the same way. They alert us to danger and help us act accordingly so that we can minimize harm. So, danger in question would be a fire. That triggers us to perform an action to reduce harm, which would be to evacuate whatever building you're in and to alert the fire station. That said, fire alarms don't always work as they should. Sometimes the alarms get jammed, sometimes there's a malfunction, and sometimes the alarm gets pulled accidentally. By pulled accidentally, I mean there's not actually a fire that needs to be put out. There's no fire. I'm sure most of us have been in school, in elementary school at least, and there's like one kid that is just like, oh, I hate this class. I want to get out of school. And they pretend to go to the bathroom, but then they pull the fire alarm so that they can get out of class. And then, we lose 30 minutes to an hour of class because they pulled the alarm. And then the fire station comes, does an inspection, and they realize that it was a false alarm, that it was accidentally pulled, and that there's no fire that needs to be put out. So for folks with chronic pain, this fire alarm analogy can kind of be true for them, right? Sometimes that alarm gets jammed and it's just constantly ringing and alerting you to danger, and there's an urgency to it, when in actuality, there's no real danger present. There's no fire that needs to be put out. So this analogy really, really resonated for me. I think maybe in part because it was so clear and easy to understand. It was a very logical analogy. It made sense to me. And, I don't know, something about it really struck a chord. And so I had these little Post-it note kind of things, and I wrote on a bunch of them, not every alarm is a real alarm. Sometimes there are false alarms. Sometimes there is no fire to be put out. And I put that on top of my workstation. I put that on top of my bed. I put that in different places of my apartment as a kind of physical reminder that not every sensation that I feel in my body is urgent. Not every sensation that I feel in my body is an indication that something is fatally wrong with me. This is not to say that those sensations are unpleasant, right? Definitely when I was in pain like that, is not to say that I'm dismissing my own pain, but it's to say that I can acknowledge that I'm in pain and that it's uncomfortable while simultaneously knowing that my life isn't in danger in that moment, to help me not go down that vicious spiral where I end up checking myself into the ER convinced that I'm dying for the 40th time. So that was really, really impactful for me, and that really helped. And I remember that I also took that saying, sometimes there's not a fire to put out. And I wrote that down and I shared it with my therapist, and we talked about that for quite a few sessions. And then we started practicing mindfully staying with the unpleasant sensations that I was having. But instead of ascribing a negative thought to them, like a catastrophizing thought, I practiced giving them a non-judgmental thought. So my vulva is itchy. Okay. I would say, you are experiencing itch in the vulva right now. It's okay. There's not always a fire to put out. I will keep track of this and note if it gets worse and a doctor does need to be consulted. But in this moment, I know that I am not dying. It could just be that there's no fire. So I'm going to mindfully note this down, but I'm not going to let it consume me and take me down that spiral like it used to. So it's important for me to note here that, the fire alarm analogy, while it was really powerful and really helpful for me, it wasn't always super easy for me to just put that into practice. And I wanted to share a question or a problem that I came up against initially when I was trying to put that into practice for my life. So, I started experimenting with noticing a bodily sensation and neutrally kind of mindfully noticing it without ascribing those kind of catastrophic feelings to them. So, okay, pain in elbow. All right, pain in elbow, I'm feeling it. Okay. And then I move on. Or if there's an itch in my vulva, it's like, okay, Monday, there's a little itch, seems a little bit more itchier than usual, but I'm not going to go to the place that I usually go where I'll end up at the ER convinced that I have cancer and that they've missed something. I'm just going to mindfully note it down and kind of track it, but track it in a neutral way and kind of go from there. So, but then I ran up against this issue or this question where, I remember bringing this up to my therapist and I said, well, okay, so, I understand and I can see the value in the fire alarm analogy and the value in neutrally noticing your bodily sensations. But I said to her, how do I know, which which sensations actually have a fire and which don't, right? How do I know which ones I need to actually take action on and which ones I don't? Because I've definitely been in a situation where I've brushed something off. I remember I got a tetanus shot once. And tetanus shots, like any vaccine, they can be a little bit painful and there can be some swelling and redness after. So, and there was, and I remember thinking like, okay, that's normal, like it's fine. And it just kept swelling. And this might not make sense if you're not from Canada, but if you're from Canada, it swelled to the point where it looked like there was a timbit in my arm. So if you're not aware of a timbit, it's like a donut hole like this big. And yeah, so it swelled up pretty big. And I ended up with a really bad infection and needed really severe antibiotics for that. And so that's the kind of point that I always go back to, because I would always say, well, I ignored those sensations and there actually was a problem that needed to be addressed. So how do I know when I need to be speaking up and advocating for myself versus when I need to kind of just take a step back and let things be and know that sometimes there's not a fire to put out? And the truth is there's no clear answer on this, right? It's a tricky question. It's a really tricky question. And the answer is going to look a little different for all of us, but I'll kind of share what I did, or, the path that I was kind of led down. So what I ended up doing was, I would say, okay, I'm itching on Monday, and I would try to just neutrally notice that. So do my best to not go to, oh no, I'm getting worse. My case is so severe. I'm hopeless. It must be vulvar cancer since I'm not responding the way that I think I should be responding. And try my best not to go there. When I do, I don't judge myself, but I try to just bring myself back to that neutral place, note it down, and then let it be. Now, if that itch continued throughout the week, I would just again keep mindful note of it. And then if it persisted after a week, I would allow myself to take action. I would give my family doctor, book an appointment, and I would bring up that itch with them. And then I would let them determine what my next course of action is, instead of me just rushing to the ER or spending days with debilitating panic attacks because I'm convinced that I'm dying. So for me, it was really about balance and balancing that out. And again, it's an art, it's not a science, right? It can be really difficult, but in time, doing that along with medication, along with a lot of therapy, along with a lot of pain education, and then really learning about lichen sclerosus, really getting the proper education about what lichen sclerosus is and all of those details, that really helped me tremendously in calming my health anxiety. So remembering and reminding myself that not everything, there's not always a fire that needs to be put out. So sometimes I tell myself with this, my other conditions, right? My face always hurts a little bit and that's okay. And I always tell myself like, there's not always a fire to put out. My alarm is just jammed. There's a little kid pranking me up in my brain and he's pulling the alarm again. And I'm just going to smile and watch him do this. And I'm going to move mindfully through this instead of going into old kind of patterns that really do not serve my mental health. So just to wrap up, I just want to say that, how I experience health anxiety may not be how you experience health anxiety, and that's okay. all of our experiences are valid, each and every one of us. And I also want to note that what works for me may not work for you either, and that's also okay, right? In life, we got to find what works for us. We got to honor our body and our needs and work in that space. So if this doesn't resonate with you, or you try thinking about it and you're like, no, this isn't my thing, that's okay. That's okay. Check out that blog post I did. There are a bunch of other evidence-based options that you can kind of look through. Definitely try and find support, someone to talk to about this, because it can feel really isolating. And even though it feels isolating, you are definitely not alone in this. I speak to so many people with lichen sclerosus that struggle with health anxiety, so you're definitely not alone. So in sum, health anxiety is a preoccupation or heavy worry about being ill or getting ill. It's not just a sporadic worry or a little anxiety here and there that maybe you're sicker than you think. It is a chronic, and I'm talking like weeks, months, years. For me, definitely, I fall into the category of years, where these worries and fears dominate a large part of your life. If you have lichen sclerosus, this might manifest as obsessive vulva checking, extreme elimination diets, not trusting the results of your tests, even though they've run the same test multiple times, and you just keep having them issue another one because you just don't trust it and they must be missing something. These types of things can be, not guaranteed, but they may be, a sign that you are struggling with health anxiety. And health anxiety is on a spectrum, but for most of us, it feels very scary and very, very real. So if you're watching this, know that there are ways that you can work to manage your health anxiety. I discussed the fire alarm analogy and how it helped me in this post, or in this video, but I do have a post that has multiple other things that you can experiment with. And if you're watching this video and you don't have LS, but maybe your partner or friend or family member has LS and you suspect that they have a health anxiety, please be gentle with them. Please show up for them with a lot of patience and a lot of compassion. Understand that for them, these fears are painfully real. They are so real and so terrifying. They don't mean to, make you anxious or make you worry. We're not trying to make your life harder. We are just scared, and we need love and compassion and patience, not dismissal. So please just show up for your people, show them this video, share the blog post so that they know there are resources, and hopefully you and or someone you know will start to slowly get this managed and under control. So that is it for this video. I will catch you in the next one.